Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Okay, let's unpack this. You've brought us sources talking about something, well, pretty remarkable in medicine. This idea that a single infusion, just one, of a cell therapy might lead to long-term remission. Maybe even a cure for really tough blood cancer, multiple myeloma, especially for patients where the disease has come back or stopped responding.
Yeah.
That's quite a hook you found.
It really is, and that's exactly what we're diving into today. These new findings on treating what the sources call relapsed or refractory multiple myeloma. So yeah, myeloma that's returned or become resistant. We've got a health news piece and, importantly, a very detailed scientific paper on a study called CARTITUDE-1.
Right, CARTITUDE-1. So our mission here, based on this material, is to really understand what these sources say about this therapy. Cilta-cel autoleucel.
Cilta-cel autoleucel, yes. Bit of a mouthful.
Yeah. Let's figure out how effective it is long-term, maybe who benefits most from what they saw, and, what this could all mean for treating multiple myeloma down the line.
Exactly. And just to set the scene quickly, multiple myeloma, the sources explain, it's a cancer of the plasma cells in the bone marrow. Often responds okay at first.
But the big problem is it comes back, right? Or it just stops responding to treatments. That's the relapsed refractory part.
Precisely, especially after patients have already been through several different types of treatment.
And historically, the outlook for those patients wasn't great, was it? The sources seemed pretty clear on that.
Not at all. For these heavily pretreated patients, the sources mentioned that typically the cancer would start growing again, that's progression-free survival, in less than 6 months.
Less than 6 months.
Yeah. And overall survival is often only around a year. So finding something that gives people significantly more time, that's a huge deal.
Okay, so this therapy, cilta-cel autoleucel.
Which the sources thankfully shortened to cilta-cel.
Cilta-cel. Okay, much better. So what is it exactly?
It's a CAR T-cell therapy. That stands for chimeric antigen receptor T-cell therapy. Basically, you take a patient's own immune cells, their T cells, collect them, send them to a lab and genetically engineer them. You tweak them so they can recognize a specific target on the myeloma cells. In this case, it's something called B-cell maturation antigen, or BCMA.
So you're training the patient's own immune system to fight the cancer.
That's the idea. These engineered cells, when they're infused back into the patient, and the study says it's just a single infusion.
One shot.
They should hunt down and kill the myeloma cells that have this BCMA target.
Right. Take immune cells, train them, give them back. And the study, CARTITUDE-1, tested this in those really tough-to-treat patients.
That's right. CARTITUDE-1 was a phase 1b/2 trial run at multiple hospitals. They enrolled 97 patients with this relapsed or refractory multiple myeloma. And like you said, heavily pretreated. They'd all had at least 3 previous lines of therapy.
So they'd tried at least 3 different approaches already.
Yes. And crucially, almost all of them were resistant refractory to the 3 main classes of drugs used for myeloma. Their cancer just wasn't responding to standard treatments anymore.
Wow. So these are patients facing really limited options, poor historical outcomes. They get this one infusion of cilta-cel. What happened? What did CARTITUDE-1 find long-term?
This is where it gets really interesting, according to the sources. They followed these patients for a median of over 5 years. 61.3 months, to be precise.
Over 5 years.
And a significant number of them were still alive and their cancer hadn't progressed.
How significant? How many of the 97?
It was 32 patients, so almost exactly 1/3.
1/3. Still alive and progression-free 5 years later.
Yes, and this is key, without needing any ongoing maintenance therapy for their myeloma during that time, just from the single infusion.
No continuous treatment.
No continuous myeloma treatment mentioned for this group in that period. And get this, of those 32 patients, the sources say 31 achieve what's called a stringent complete response.
Stringent complete response.
Yeah.
Sounds deep.
It means a very, very deep remission. Basically, doctors couldn't find evidence of the myeloma using standard tests, and this was confirmed by an independent review.
Okay, wait. 1/3 of patients who historically might have progressed in under 6 months are alive 5 years later, progression-free, nearly all in deep remission from 1 dose.
That's what the data shows.
That's completely different from the historical picture you painted. That's huge.
It is, and that level of lasting, treatment-free response is exactly why the sources start talking about a potential cure.
Right, that phrase, potential cure, it carries a lot of weight, especially with cancer. How do the investigators, based on these sources, justify using such a strong term? What's the evidence?
Well, they interpret these really long treatment-free remissions in this subset as evidence pointing towards potentially curative outcomes. They back it up with specific data. For example, one hospital involved in the study tracked 12 patients who were in that stringent complete response.
Okay.
They did serial testing over time. And at 5 years or even later, after their cilta-cel infusion, all 12 of those patients tested negative for minimal residual disease.
Minimal residual disease.
MRD, right?
What does MRD negative mean here? Did the source explain that?
Yes, they did. Minimal residual disease testing is super sensitive. It can detect tiny amounts of cancer cells left behind, way below what standard tests can see.
Yeah.
Being MRD negative means the level is below a certain threshold, often less than 1 myeloma cell per 100,000 normal cells.
So incredibly low levels, basically undetectable by these sensitive methods.
Exactly. And these 12 patients were MRD negative and had clean imaging scans 5 years out without needing more treatment. That combination, deep response, long duration, no detectable disease by sensitive tests, treatment-free, that's what leads the investigators to say this is potentially curative for some.
That detail really helps understand why it's such a big deal. It's not just surviving, it's the quality and depth of that survival without ongoing therapy. Okay, so these 32 patients had this amazing outcome. Did the analysis show anything about who these patients were? Any common factors? You mentioned an exploratory analysis.
They did look into that, yes. The sources stress it was exploratory, meaning these are trends they noticed, not yet confirmed predictors, but they look for characteristics associated with being progression-free for 5 years or more.
And what kind of trends popped up?
Trends suggested that patients doing well long-term tended to have sort of less cancer burden to begin with. Like numerically, fewer of them had what's defined as high tumor burden at the start. They also had lower levels of that soluble B-cell maturation antigen protein in their blood, the DARN protein. Lower levels might mean less overall cancer. And fewer plasma cells counted in their bone marrow samples before treatment.
So starting with maybe a slightly less overwhelming amount of cancer could be a factor. Makes intuitive sense.
That seems to be the suggestion from these trends, yeah. Also, things related to general health. The long-term responders tended to have higher hemoglobin and platelet counts before the infusion. And then there were some interesting trends related to the CAR T cells themselves.
Ah, the engineered cells. What about them?
Well, it looked like having higher proportions of what are called naive T cells in the infused product was linked to better outcomes. Naive T cells are like the younger, less specialized immune cells. Some think they might expand better and last longer after being engineered.
Interesting. Younger cells might be more robust.
Potentially.
Yeah.
They also saw trends like a higher ratio of T cells compared to another immune cell type, neutrophils, when the cells were first collected. And after infusion, things like higher effector to target ratios, basically how many killer cells there are per target cell, and greater peak expansion of the key CAR T cells seemed linked to long-term success.
Yeah, okay. Let me try to simplify that based on what you're saying from the sources. It sounds like it might be a combination of the patient's overall health, maybe starting with a bit less cancer, and then having the right kind of T cells collected, engineered well, and really multiplying and fighting hard once they're back in the body.
That's a really good summary of what these exploratory findings hint at. These are definitely clues for future research. Can we predict response better or even improve the therapy based on these factors?
Right. And thinking about powerful therapies and long-term results, what about safety over those 5 years, especially for those 32 responders?
Good question. The sources did cover long-term safety for that specific group of 32 long-term progression-free survivors. They reported safety was generally consistent with earlier reports from the study. Importantly, they noted no new cases of certain specific neurological side effects like Parkinsonism or issues with cranial nerves that had been seen earlier in the overall study population. None new in this specific long-term group.
Okay, that's reassuring. Were there any other long-term side effects mentioned for this group?
Yes, they did report some events within those 32 patients over the 5 years. There were 2 cases of secondary primary malignancies, meaning new, different cancers, both solid tumors. There were also 2 neurologic events reported, and 4 cases of infections that were grade 3 or higher, meaning serious infections. So, while the outcomes were fantastic, there are still potential long-term health issues to monitor, even if the numbers were small in this subgroup.
Absolutely. Important context. So, stepping back again, what are the really big picture implications here? How significant is this finding compared to what came before?
The main takeaway, emphasizing the sources, is just how unprecedented these long-term treatment-free remissions are. 5 years or more for patients who previously had such a bleak outlook. It just wasn't seen with standard care. And another key point, this benefit wasn't just limited to patients with standard-risk myeloma. They saw these durable responses even in patients who had high-risk genetic features or cancer outside the bone marrow, what's called extramedullary plasmacytomas.
Wow, so it could potentially help even those with more aggressive disease forms.
That's what the findings suggest, yes,
Yeah.
which is very encouraging.
And if it works this well in such late-stage, difficult cases, does it make you wonder about using it earlier?
Absolutely. That's a major question the sources raise. If cilta-cel can do this for patients who failed multiple therapies, what could it do earlier on? They actually reference another trial, CARTITUDE-4, which looked at cilta-cel in patients who hadn't had as many prior treatments.
And what did that comparison hint at?
Well, the sources note that in CARTITUDE-4, a higher percentage of patients achieved that really deep MRD negative state. It was 73% in CARTITUDE-4 versus 59% in this CARTITUDE-1 study.
Ah, so using it earlier might get even more patients into that deep remission state that seems linked to these amazing long-term outcomes.
That's the implication, yes. And based on that kind of thinking, the sources mention clinical trials are already happening, CARTITUDE-5 and CARTITUDE-6. These are looking at cilta-cel for newly diagnosed multiple myeloma patients.
Newly diagnosed, so right at the beginning.
Exactly. The hope is maybe it could even replace the current standard initial high-intensity treatment involving autologous stem cell transplant. Could it potentially offer a cure or something like it much earlier in the disease journey? That's the big question these new trials are asking.
Replacing stem cell transplant, that would be a massive shift. Now, you mentioned sources. Were there any limitations called out in the scientific paper about this 5-year follow-up specifically?
Yes, they did note one limitation regarding the extended follow-up. Patients who continued past the main study went into another one called CARTITUDE. And in CARTITUDE, their monitoring was based on the local standard practice at each hospital. Didn't mandate centralized lab testing for everyone, including things like that sensitive MRD testing.
Ah, okay. So while they still tracked survival and whether the cancer came back based on local doctors' assessments,
Right.
they didn't have perfectly uniform, centrally analyzed MRD data for the whole group over that entire long-term period.
Exactly. So that lack of fully standardized, comprehensive data, especially on MRD status deep into the follow-up, made it harder to do really detailed analyses across the whole group to pinpoint predictors of who did well or why some eventually progressed.
Got it. A practical limitation in long-term data collection, though the core survival progression data was still there. So despite that, what was the final word from the investigators themselves in the paper? What's their takeaway?
The authors concluded that these 5-year CARTITUDE-1 results, especially when considered alongside results from another study called LEGEND-2, give us the longest follow-up data we have for any CAR T-cell therapy in multiple myeloma so far. And based on all this, they state that these findings provide the first evidence that cilta-camptothecin autoleucel is potentially curative for patients with relapsed or refractory multiple myeloma.
The first evidence of potential cure for this group. That's quite a statement.
It is. And they are careful with the word potentially, but the data, especially that sustained MRD negativity in the tested subset, really makes a compelling case that this might be a reality for some patients.
Okay, so let's bring this back home for you, the listener. We've dug into these sources you brought, looking at this tough disease, multiple myeloma when it comes back, or resists treatment. We talked about this innovative CAR T-cell therapy, cilta-cel, given as a single shot. The really striking CARTITUDE-1 results. 5 years later, 1/3 of these very sick patients still alive, progression-free, mostly in deep remission. We explored the evidence that leads researchers to talk about a potential cure, including that MRD data. We touched on those early hints about who might benefit most, the biomarker trends, talked about long-term safety, the potential to use this earlier, and also noted that limitation about long-term data collection.
But yeah, the core finding really is the headline here. 1/3 of patients who previously had very few options in a grim outlook, getting 5+ years of durable treatment-free remission from one dose of cilta-cel. That just wasn't happening before.
So maybe a final thought for you to chew on, building on this idea of potential cure from the sources. How might this possibility, a single treatment offering potential long-term cure for a complex blood cancer, how might that change how we even think about fighting these diseases? And what's the next research step needed? Is it confirming these biomarker hints? Or designing trials for really rigorous long-term MRD tracking to solidify these incredible outcomes? Definitely keep an eye on how breakthroughs like this continue to reshape what's possible for patients.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.